Okay, so good evening. I'm Deborah Bass, and I'm the U.S. President and Global Chief Marketing Officer of Nuvo. Nuvo is an Israeli health tech company, actually headquartered in Tel Aviv, and I'm U.S. Employee 1, based out of Princeton, New Jersey. We have a bold ambition to reinvent pregnancy management for the 21st century. And why does this matter? On the home front in the US, we are in the midst of a pregnancy crisis. Did you know that the US is the deadliest developed nation to have a baby? We are impacted by troubling trends in pregnancy. There's an increase in high-risk pregnancy. Moms are older and sicker. High risk, about 25% of the incidence, 45% of the cost. An increase in infant and mother mortality despite spending more than any developed nation or anyone in the world. And just when more care is needed most, there's a shortage of OBs on the horizon. There must be a better way. So we have a vision that's broader than pregnancy, but we'll start with pregnancy. I want to put our bigger vision out there. We want to be the transformational leader in maternal fetal health. There's 2 patients we care for in the world of Nuvo, and it's about igniting a community of action to improve the most important first 1,000 days of life. That's fertility through pregnancy, through early childhood, which is formative for lifelong health and vitality. So what is the state of the state today? Today, pregnancy monitoring is a burden on mothers and the system. And I think this is a word picture that tells it all. So imagine being 33 weeks pregnant, feeling heavy and uncomfortable, and having to commute 2 hours to wait in a waiting room for an hour to get plugged into a wall for 45 minutes in 2019. But this is what we go through as patients or women in the system today. Not only is it burdensome and not life-friendly, but it's actually broken in terms of the journey is fragmented and episodic. Current tools and technology, electronic fetal monitoring, are 50 years old with poor data fidelity, particularly TOFO, which has about a 35% failure detection rate for contractions. And it's a disconnected care episode. Both the OB care team, but also the peripheral doctors like the psychiatrist or the cardiovascular expert or the endocrinologist, depending what your needs are. So there's an opportunity to reinvent pregnancy from the bottom up and systemically, which is what Nuvo has developed. So I want to introduce a new world of connected pregnancy, where mothers are the point of care and data seamlessly connects visits across the home, the hospital, and the office. This is medical-grade mother-centered care designed to improve outcomes, lower cost, increase satisfaction, and really what's needed in the 21st century. I invite you, sorry, one more quote and then my invitation. So this is a great quote from Joe Scott, who is on the executive committee of Robert Wood Johnson Barnabas Health, the biggest health system in New Jersey. By the way, New Jersey is 45 out of 50 in terms of worst mother mortality rates in the country. Joe Scott has said to me, there is no better time to introduce a 21st century pregnancy management platform, given the acute need to reduce both mother and infant mortality. So I want to invite all of you to join the #maternity movement. Please log into nuvocares.com, share your story, share your inspiration. It takes a village to give every life a better beginning. Thank you. So 2 questions from the audience. Who's bold first question? Does anyone have mothers, daughters, want to lean into this space? Inquire more? Learn more? Frank, thank you.
Who's the ideal expectant mother for this device?
So I would say that the platform is designed for all moms, but there's the most acute need for high-risk pregnancies because they require more monitoring and they have more complications. So those moms desperately need better tools, as do the doctors that care for them. So we're leaning in there, although offering it to all. And maybe tell me your name and.
Okay.
Okay.
So, is this a medical device or a consumer thing? Does it require like prescription and get reimbursement?
So, excellent question. So this is a medical device. We are currently in the regulatory pathway as a 510K Class 2, and we at Nuvo believe that that's the most responsible way to move monitoring to the home, a connected care episode between doctor and patient that's driven by a prescription, a doctor-directed protocol, but empowers mom with a high fidelity data understanding of what's going on. So she's an equal actor and empowered in her care equation. Thank you.
Thank you.